QRST is related to ventricular contraction. Failure of lymph circulation would affect transport between the blood cells and blood. Neurogenic heart is seen in cockroach. A heart sound which is high pitched, louder, sharp, and shorter in duration is the result of closure of semilunar valves. Macrophages arises by the enlargement of monocytes. In a healthy adult human being, the normal diastolic pressure is 80 millimeter 80 mmHg. Rate of heartbeat is controlled by sympathetic and parasympathetic nerve. During diastole, the blood enters the heart. Antibodies are formed in lymphoid tissue. The specialized muscle fibers called the bundle of His is situated in the septum dividing the right and left ventricle. Arteries are thick walled and blood flows under high pressure. Chordate tendina in the heart are found in ventricle. The chief difference between the erythrocytes of man and frog is human erythrocytes have no nuclei. Serum differs from plasma in absence of fibrinogen and other clotting factor. Blood flows out from the heart through aorta and pulmonary artery. Potassium oxalate prevents clotting of blood by removal of free calcium ions. Normal pulse pressure is 40 mmHg. Large phagocytes destroy the worn out RBC in liver, spleen, bone marrow, and lymph nodes. ECG is a recording of the electrical changes in the heart during its contraction and relaxation. In man, blood passes from the post-caval into the diastolic right atrium of the heart as a result of pressure difference between post-caval and atrium. Rh antigen and blood group antigen resides in plasma membrane of RBCs, leukocytes, and platelets. In man, the portal circulation carries blood from the alimentary canal to the liver. Which of these is present in the heart of frog? SA node. Thrombokinase is released by blood platelets. The sinus venusus in the heart of frog receives blood from major veins and passes it into right atrium. In prawn, the heart pumps oxygenated blood. The impulse of the heartbeat originates in sino-cunicular node. In human blood, the number of leukocytes per cubic mm is about 4,000 to 12,000. Mammals have biconcave RBC. The physiological use for it is to increase the surface area. Mark the odd one out. Erythrocytes Ringer solution contains sodium and potassium ions. AV node in the heart of man is pacemaker. When heart is stimulated through vagus nerve, the heart rate will decrease. The pH of human blood varies between 7.3 and 7.45. Larger erythrocytes in vertebrates are found in ostrich. A man becomes unconscious in the blood supply to the brain is cut off for 5 seconds. A yellow substance oozing out from the wound has lymph plus dead leukocytes. The blood protein which maintain normal blood pressure in man is albumin. Most important center for formation of lymph is liver. The blood of rabbit differs from through of frog in that the RBC have no nuclei. A blood clot inside a blood vessel is known as thrombo. Labile factor and Christmas factor are associated with blood coagulation. RBC would burst if kept in hypotonic solution. The ratio of RBC to blood plasma is expressed as the hematocrit. The medium of plasma is basis. Like the blood vessels, the cavity of the heart are internally lined with endothelium. Which of these does not depend on a large surface area for its efficient functioning? Thigh floor sole of alimentary canal of earthworm. Of the circulating WBC, neutrophils on an average make up 60 to 70% of total WBC. Blood platelets are formed by the pinching of protrusion from the surface of megakaryocytes. RBC are formed in bone marrow,